everyone. So today I will briefly talk about the DEA substances classification, the 5 schedules. I'm not going too deep in it, it's just for the NCLEX point of view, the basics which you should be knowing. So the US Controlled Drug Classification by the Controlled Substance Act, DEA, as classified substances which has a high potential for abuse and dependence into 5 schedules. Now, Schedule 1 is the most dangerous and Schedule 5 is the least. It has the least potential for abuse or physical dependence. So let's draw a pyramid. So Schedule 1 is the drugs that come under Schedule 1 are commonly heroin, marijuana or cannabis, LSD, ecstasy. So these are drugs which even today we don't use it for medicinal purpose because it is dangerous, it has a high risk of potential abuse and physical dependence. So Schedule 1 is not used for medicinal purpose. Next comes the Schedule 2. Schedule 2 also is dangerous. It has a high potential for physical dependence and abuse, but it has some medicinal values too, such as drugs such as cocaine, hydrocodone, methadone, fentanyl. So these are Schedule 2 drugs are used for moderate to severe pain as an analgesic. It is used for anxiety, insomnia, but again, we have to be cautious while using it. The refill, it depends from state to state within the United States, it varies, but generally, yes, prescription is required. Refill is also controlled. So they might, after 6 months or depending on the state, the rule varies, but you cannot just or call and get the prescription refilled. You need to go to the doctor and the doctor has to in person sign and request for refill. You cannot do it over phone. And like I said, it is dangerous, but it is still used for medicinal purpose. Then we have the Schedule 3. Now Schedule 3 is less dangerous than the Schedule 2, but again prescription is required and there is a risk of potential abuse and dependence, but not as much as 2 and 1. Now under Schedule 2 comes testosterone, certain anesthetics like ketamine, then anabolic steroids. So these are the drugs which are acetaminophen with codeine. So these are the drugs which come under Schedule 3. Again, prescription required. Then we have Schedule 4. So Schedule 4, easy to remember, your benzodiazepines. Remember all the diazepam, so the azepam and alprazolam. Remember these two. That is those ending with azolam and those ending with zepam. Diazepam, alprazolam, midazolam, lorazepam, and also Ambien, used as a sleeping pill. Okay, which is a brand name for zolpidem. All of these come under the Schedule 4. Again, prescription required, but you can it can cause dependence and abuse, but less compared to 3 to 1. Lastly, you have the Schedule 5. So Schedule 5 is least abuse or dependence it can cause, but there is still a risk. So Schedule 5, the drugs that come under Schedule 5 are mostly used for the treatment of antidiarrheal. Antidiarrheal such as diphenolxylate plus atropine can reduce the motility. So if you know the infection is not, if you know the diarrhea is not due to an infection which needs to be treated by antibiotic. So if you know the diarrhea is not due to infection but you need to reduce the motility then. So you can give diphenolxylate plus atropine which will reduce the motility. Again, it can be used as anti-cough, robitussin plus codeine. So codeine causes cough suppression. So dry, irritating cough. So robitussin plus codeine again comes under Schedule 5. So it can be used for cough. It can be used for analgesia. Okay, pregabalin, elixir with codeine. Now Schedule 5, you may get it without prescription, or it could be prescription or without prescription, but it is not over the counter. You have to go to the pharmacist, get a written request, they'll verify the age and everything, and you'll get it. Okay, but it's not present over the counter. So these are the 5 schedules. Schedule 1 being most dangerous and Schedule 5 being least risk of substance abuse and dependence. Now this you need to know for an exam point of view. Very commonly you see, oh, cocaine belongs to Schedule 2. So you need to know what it is, right? And these are all regulated by a federal, so this thing, the DEA controls it. And we need to abide by it. Thank you.